our end of the show, 2.5 months. Today we'll put the slides, fallopian tubes, ovary, testes. You open your tab, you see the microscope. Don't click, click, click. Put your phone. It is not. You won't find anything. এবার তুমি তো ফোনটা নিয়ে ঢুকতে পারবে না। One thing. তাহলে তুমি শেষ করতে you cannot compare. You have to know any structures. It has to have a blood supply, a nerve supply, and blood supply means artery, vein, and what organ it is. Key identification points. Just 1, 2, 3. Okay. Every day in these 4 days or 5 days examination, 1 or 2 slides will be altered. We won't bring any new slides anywhere from. So the things you are viewing today will be viewed in the final exam. It is from the same block. So the best slide of that specific organ will be given under the microscope, placed under the microscope. Examination doesn't mean we want to screw you up. Even Professor Roy, Subramanian, we don't want to screw any person. You have to, don't leave a blank sheet. I told you from the day one when I told you when you began your histology, I told you that key points of any organ. Say kidney. Now kidney, it has glomerulus, Bowman's capsule. The rest you build up 1 or 2, 3 points. That is remarkable. This is one thing. Second thing, say thyroid. Thyroid cells, your colloid. Now liver, thyroid, kidney. If you have the different slides, they are different from each other because they function differently. 10 marks on spotting. Chakka. Second thing, short note, 2 or 5 or 4. So within, it is around 15 marks you are stored up in your passing the exam means add-on. Take histology as an add-on. When you are viewing, you just sit. এরকম করো না, একটা চোখ তুই দেখছিস, একটা চোখ তোর বান্ধবী দেখছে. Don't do that. It's a binocular, this thing, microscope. But binocular vision, human vision. And today we started retina and visual cortex and visual pathways. So দুটো উল্টো পাল্টা হয়ে যাবে. So just comfortably, just 5 minutes, 1, 2, 3 points. You open up your book, see, and move off. Move off means একবারে 15 মিনিটে ক্লাস ফাঁকা করবে না, কারণ এইটা ফেজটা হচ্ছে ইন্সপেকশন ফেজ. This week to coming Wednesday, NMC inspection. So if you all are not in the class or anything, expected inspection will be there. So please be present in your classes. Sit tight. If this is a demonstration class, one person comes. They will see how we are teaching, and they will see the attendance, presence of pupils. Now I have drawn, I have placed these slides. This is one follicle. Now here you see blood vessel packed with RBCs. Packed with RBC. Okay, packed with RBC. Now this is the cortex and this is the medulla part. ঠিক আছে, এখানে ফলিকল। Now you see, now if you for your own interest, you just move this slide up. The fine adjustment. It up and down. Yeah, yeah.